You often say that ignorance is the most dangerous substance. If better information exists today than ever before, why do we still see so many preventable harms related to drugs?
That's a great question, and the reason is probably because even though the information is there, people is not aware that there is a valuable information that can reduce the harm of the drug use. If we're talking about legal drugs like alcohol or tobacco, and also if we're talking about illegal substances like cocaine or amphetamine, there are ways to minimize the harms as much as possible, even though there will always be harm when you are using any kind of drug.
So, harm reduction is widely supported by science, yet still controversial in public debates. Why do you think evidence-based approaches to drugs continue to face such strong resistance?
Because unfortunately drugs are also a moral issue for many people. And even though there is a lot of evidence that harm reduction can be very valuable and can be very effective, people still see drugs as a moral problem. And this is a very big limitation that we have in the field.
Through Drogopedia, you classify substances, stimulants, opioids, psychedelics, depressants, and more. How does understanding what a substance actually does in the brain change the way society should approach drug policy?
First, because it provides information on what are exactly the harms and risks of the different drugs and how can we prevent them and minimize them. And also because they will show people that drugs are also legal substances in some cases and also medical substances in other cases. So we're talking about a big family of substances that can be legal, medical or illegal, and the difference among them is not a difference that is in their chemistry most of the times. It's a difference in the way we decide to treat them with our drug policies.
And finally, looking at the trends in psychedelics, synthetic drugs and microdosing, what major shift do you think drug policy and public health systems will need to make in the next decade?
I think the big shift that we're going to see in the next years is probably the authorization of medical use of psychedelic substances for treating different psychological conditions like depression, anxiety, addictions, and post-traumatic stress disorder. I say this because of two reasons. The first reason is that psychedelic drugs are extremely powerful when it comes to treating some conditions when they are used in very controlled settings with medical supervision. And this is something that we will need to make available for patients in the next year. So this will force the drug policy to change, to evolve, to let these drugs to be used in very controlled settings like hospitals, for example. And the second one is that since some of these psychedelic substances are able to treat addictions, we will probably see how these psychedelic drugs are able to minimize the addictive problem in the world made by other drugs. So we will see a case of some drugs fighting against the other drugs or the problems that are delivered from taking other drugs. So this will be a big change, and it's probably going to be very exciting to see how drug policy adapts to this new situation.